Welcome. This short video will cover patient active-inactive status, also known as PAIS, for non-owning organizations in the Washington State Immunization Information System, or IIS. Some examples of non-owning organizations include pharmacies, schools, hospitals, urgent care centers, and local health jurisdictions. This video covers the information in the Managing Patient Ownership and Status Reference Guide found on the Washington IIS Training Portal at www.doh.wa.gov/training-IIS. For non-owning organizations, patients will show as inactive or deceased. Patients will show as active and owned for owning organizations and facilities that enter new patients into the system, or if they administered the most recent vaccination. An owning organization is defined as a patient's primary medical home where they receive the majority of their medical care. Owning organizations include public and private healthcare clinics and student healthcare centers. For non-owning organizations, all patients will show as inactive on the patient demographic screen. You can enter administered vaccinations and make edits to the patient demographic information, even though the patient shows as inactive. When you make an edit on the patient demographic screen, notice that the patient status field has two available options, inactive and deceased. Unless the patient is deceased, you should not need to change this information. The Manage Population functionality can be found in the navigation menu on the left under Patient. As a non-owning organization, you'll want to limit the report by Search for all patients that I have vaccinated. This will show you a list of all patients vaccinated by your facility and their current owning organization and facility or medical home. All patients will show as inactive for your clinic, even though they show as active for their owning organization and facility. As a non-owning organization, you can run reports by service. This will identify all patients vaccinated by your facility regardless of their owning organization or facility. Patients can have service records from many providers, meaning they have received vaccines from multiple places. If you run a report by service, ensure that you also select to include inactive patients towards the bottom of the report parameters page. For general IIS account help, please contact the help desk. For training and troubleshooting guidance, please email the IIS training team at iis.training@doh.wa.gov. Additional IIS training resources are available on the IIS Training Materials portal at www.doh.wa.gov/training-IIS. Thank you for watching this video on PAIS for non-owning organizations in the Washington State Immunization Information System.